he inject himself, such as HIV, AIDS, or diabetes, do you just drop the matter? You're more than a little nervous about seeing your friend at the hospital again tomorrow.
So first thing, what is the ethical question that you have in this situation?
Should you confront your friend, or should you just drop it?
I think he was already deciding on confronting his friend. It just was kind of like a little wrench kind of thrown in with the syringe. I still think he needs to sit him down and talk with him, tell him his concerns, and let him know. So at least he can get some type of response. And then whatever response he gets, then he can kind of make his decision from there.
Yeah. I guess the ethical question tells me, how do you approach it? Sort of what do you say and what do you do and what do you follow up on?
Because I mean, he's your friend. Like, you don't want to ruin that friendship, but at the same time, you have a professional duty to
look out for the beneficence of the patients and his own non-maleficence.
It's very similar to that one discussion post we had, and I think it's also a question of, is he doing it, like they said, for medical reasons, or is it something that is more drug-based too?
When do you try to talk to him outside of work still? Like if he keeps like canceling on plans and stuff, do you just eventually confront him at work, or do you just keep trying to get it? Yeah, do you keep trying to get him outside of work and hopefully he doesn't cancel on you one time so you can talk to him about it, or do you just eventually talk to him about it at work?
Yeah, and as
He's
long
kind
as you
of
approach him very easily, because he did say that he gets very aggressive at work, and so I don't know if that's like an appropriate place to do it if he will get aggressive, but that might be the only place because that's the only time he sees him.
I think too, if it was to be at work, it needed to be away from patients,
Yeah,
away
if
from
they overhear
his
that,
coworker.
Yes.
Maybe like at the end of a work day when he's going to be leaving us.
Yeah.
On the way out to something like that. One thing that I feel like we could be assuming a lot, and he never really said that he felt his patients were in danger, which obviously you don't want to wait till it gets to that point, because that definitely could be, but I think it's definitely something he will be like kind of walking on eggshells. But it's something that needs to be addressed because it could definitely
You
turn
don't
bad.
know.
Don't go into it accusing, like you said.
Yeah.
I'm concerned. This is different.
And then you have been acting different.
And another point is it said, like, waiting for the next day, he's nervous about it, but that could be a good opportunity to see how he interacts with his patients and look at it that way before you do confront him, so you have all the background info before you go to a compliment with him.
So we kind of already touched on some of them, but what are the rest of the bioethical principles that are kind of involved in this situation? We kind of mentioned the beneficence, and the non-maleficence of the patients. We kind of want to have their good in mind, but what else do we have for that?
Well, for sure, the other guy's autonomy.
Yeah.
We don't want to take his autonomy away if it is for good reasons.
Well, one thing I had in mind was maybe the justice of your colleague, or for him, going into it, giving him the benefit of the doubt. I don't think you're doing anything wrong, so I'm not going to report you before I have any facts, but approaching it with, I'm concerned for you and what's right for you, and also the patients in the situation.
It's the whole innocent until proven guilty thing. You don't want to assume the worst right away, but that you are concerned.
You also have fidelity to your
Full fidelity.
to both your coworker and also your profession. So
Because we're professional
The way-
gatekeepers.
Yeah.
So we can't have somebody's on drugs.
exactly.
Patients.
Exactly.
Supposedly on drugs.
Supposedly.
And then so we've also discussed this a little bit, the stakeholders that are in the situation. Who are they?
Patients, there's no indication that he is having issues with patient care, but if it is more serious in the fact that he's taking, some pretty serious drugs, it could ultimately affect his patient care.
And off of
So
that,
like you said, sorry, just prevent it before it happens.
Yeah, because you don't want to wait until it does.
and affecting the patients would definitely affect the practice, the hospital that you're working at. You're reflecting that whole, program.
And then again, the friend that he's concerned about, looking out for him and his, what am I trying to say? Well, not well-being, but his character, because
Right.
again, we don't know what's going on.
You
so
don't want to defame his character.
Yeah.
And on the other hand, if he does have a problem, he hasn't really done anything to jeopardize his career yet. If he does admit that he has a problem and then he gets it fixed, I mean, you could still possibly have like a chance at a career. But something, if you let it keep building, hurts a patient or does something wrong, and he's a stakeholder as well.
And what you also mentioned is health and well-being. It could be that this might be, if he has been having this stress and anxiety or anger issues, this could be something that is helping him overcome those possibly, or something completely different. So you would also want to make sure
Like he's using the
you are using,
as a form of
right,
his own therapy.
yeah, or just to
Prescribed
help
therapy.
him come back to
Prescribed.
his own health and well-being. It could not even be his too.
Take care of his buddies who's drug addict.
And that could be what
Like
he's
staying
out.
at his house.
Exactly.
Isn't that the next bullet too? Alternative options.
Any information that we kind of want that we don't have, any additional information we want to seek or find or would be important before we make a decision.
Is it his?
Obviously, is he using drugs?
Does he have any health issues,
Yeah.
like HIV or AIDS, that he's using this for?
And
Or
if
is there
it's not-
something else that could be affecting his, aggression or anger at work? Is something else influencing that?
Because if it isn't drugs, then I think it's pretty clear that something is bothering him, and whether it's like going to see a counselor or something, either way, if there's a problem, an underlying problem, I think that you want to get addressed.
I think you also need to make sure about the patients, like we talked about earlier, how it's affecting his
Yeah.
patients. That's
Like maybe some patients will say, hey, he seemed really weird this day, or I didn't like the way he was talking to me or treating me that day. That'd be
Follow up.
So then what would be 3 options that we could pursue or consider for, to make the decisions? What options do we have?
We already talked about one. Is it his or is it not? Because we don't know to that detail if he's having hiding it from a friend, from his friend's friends. Just getting the story straight, and finding out what is the drug, is it a drug, is it his, is it not, and then basing your approach on that.
So
is that option just like going to confront him
Yeah,
yourself?
so I think the first option would be confronting him and seeing
Yeah.
what
Because you are his
information
friend.
you can get.
Yeah.
You're gonna get the most information from that. Because I mean, especially if you think of like veracity, like you did see what you saw. So like if you just say, hey, I went to stop by and saw the stuff. I'm not accusing you or anything. I'm just making sure you're okay and something like that. So confronting him really might just give the answer, and he might not try to lie about whatever's going on too if he knows you saw it.
Just want to make sure, are those still recording?
Yeah. Well, it's wrong.
Okay.
And just by opening that line of communication, you can help, because you did have a friendship, so you could
Right.
help gain trust and be okay, I'm just trying to figure out what's wrong, what's happening. Is this going to affect your work? How can I help?
And at that point, it might help you decide where to go from there. If he needs more help, or if it's something you need to take beyond,
Right.
which is, I think, another option.
Another option, documentation.
Option number 2.
Option number 2.
I
So,
feel like that in general
think,
could
like,
just be reporting
reporting
in general,
to, like, your
whether it's a higher
manager,
supervisor or,
Which
Yeah.
I don't know if that'd be like the best option, but it's definitely an option. Just requires, I mean,
what you could do the documentation, but then not report it.
well, but any supervisor is going to see documentation because it's in your database for
You mean just
your program.
personal documentation, like writing down somewhere
Right.
that you saw it,
Your own.
not necessarily.
And not
Okay.
giving it.
Kind of
You
like
made-
monitoring the situation on your own.
So kind of
Right.
holding back
So
before
you
you do any
have it.
action.
But
Okay.
you don't
Writing it
submit it until you know for sure, hey, here's what the issue is, and I really think that you guys need to see this because I feel like it's not his friends.
And you are a friend and a PT, you're not a psychologist.
Yeah.
Right.
So you, in that, need to be able to refer to someone who can take care of it better than you as a friend.
So an option would be to do all the documentation.
Kind of
Because
wait and see what
we're supposed to
evolves.
document,
Yeah.
but then you could ultimately decide, I'm not going to submit it.
Yeah, part of me thinks you honestly need
Because
to
you-
document no matter what
Right.
option you choose, because that'll keep your story straight.
Straight.
You want to make sure everything is truthful.
And you're writing down the factual information before it becomes any emotional involvement from your friend or yourself over time. I don't want to hurt them, so emotionally kind of tuck it away. If you're writing down the facts when they happen,
Yeah.
that doesn't become involved as much.
So say we go in that scenario where we document everything. There's a fork in the road. So where we have to weigh his trust, the friendship, versus the patient. All right.
Bigger than the patient.
And the patient always outweighs our friendship and our profession. Consequence of not recognizing that the patient comes first is losing our own license. So we could get to that fork in the road, and we could take option, as we said, option 2, keep the documentation. At least we're doing what we're supposed to do, documenting. Or option 3, turn that documentation into your supervisor or whoever the proper authorities are.
So the positives of, waiting it out, documenting it but not taking any action would hopefully give your friend the benefit of the doubt, like you said.
Right.
Giving them the chance to say, well, maybe it's just this week, it's this month has been really stressful. But you're kind of risking your patience at that point. But then on the other side of it, if you immediately report it to your boss and, without confronting your friend or giving them the chance to kind of explain themselves, you then kind of open them up to any attacks for character from your boss, maybe being fired. So there's kind of the negatives of both sides. One might hurt your friend more, the other kind of leaves your
Even if it
patience
wasn't
open.
him, it's still gonna give that impression
Right.
like, oh, he's that
Sticks with
drug
you.
guy. He's gonna get labeled.
Another point of being, if you did report it and he wasn't doing that, you could lose your own trust too. Like
You lose that friendship, that
yeah. Well, even like your
Credibility.
You don't wanna be-
supervisor might not trust you as
Yeah,
much.
you don't want to be like the tattletale with it,
Right.
or even someone who's out to get someone. I might just think that.
Yeah, I was gonna say like you rely on your coworkers so much for things. So I think if you betray that trust, then you can make your own work life really stressful and really
Not only from him, but from your.
Yeah.
So based on these options we've provided,
We should
what do you?
document. You guys think so?
At
least
least
No matter what the
Okay,
case
So
is.
at least document.
But then from there, what option do you think would be the most effective in pursuing at this point with what we know now?
Talking to him
Talking
directly.
to him.
Yeah.
And the document.
What kind of response and how you feel about his
Yeah.
response, I think is what you have to decide from there. Whether you report it or not.
And part of it could be even, the solution might just be referring him on to see another specialist,
Right.
like a psychologist or
Yeah.
something of that nature. It may not need reporting.
Tim made a really good point that, like, personally, friendship kind of overweighs patient, but professionally, your duty to treat your patients always overcomes your friendship. So I think it's good to start with a friendship, go on a more personal basis, and then, like we said, document it. If we feel it needs to go to a more professional standpoint, then we progress with that.
Especially since we don't know how it affects the patients.
Well, then after, confronting your friend, you might get more details of, oh, I'm sorry you saw that, but I actually had a friend staying over, or I've been stressed because of this. Or maybe they continue to avoid it and, it just escalates. So it kind of, after making that decision, it leaves you with the options of continuing down a path of not really taking any action or reporting it. So I think once you get more information from your friend, you have a better option
Get the story straight.
of what to do.
Because once he knows that maybe that'll change his act if it is a problem, or maybe he'll realize, okay, I really am kind of taking stress out on work and stuff, and maybe it'll get better by talking to him, and if it gets worse, then at least you try to talk to him first, and then you can go to your supervisors if need be for that. So.
It's also always how you approach your coworker too. You want to make sure it's out of a caring response to your coworker.
I think you could start from a place of just saying, hey, I'm concerned, I've noticed your stress. Maybe not even mentioning the what you saw at first, and just letting him kind of come to you, and maybe it'll come out rather than being accusatory right from the beginning.
Yeah.
I think a lot of people like shell up and hold up if you start from accusing them.
Well, and even, if he's embarrassed at this point because something personal is happening,
Yeah.
I know it's very easy for friends to be, I'm embarrassed to share this. I don't want to talk about this. It's personal. And a lot of times I think, saying that I've noticed this, are you okay, might give them that opportunity to be honest and open up about what's going on. So, any other thoughts?
A lot.
Was there the part, like if it is the worst situation, wasn't that part of the?
Yeah.
So like, I'm guessing
Worst
that's like
case
if you go to him and you confront him, he says, "Yeah, I'm like using heroin or something."
Right.
We obviously report that.
And that's a whistleblowing
Yeah.
situation.
Yes.
You would have to, it would be very difficult, but
That's definitely
Yeah.
in the code of ethics.
I mean, so I'd probably let him know and say, "Hey, I'm sorry." Like, even he might say, "I don't want you. Like, I'm going to try to fix something else." But that's something you have
And then in
to.
that case, I guess who do you go to first? Would it be your supervisors or even?
I feel like just
Authorities?
chain of
Yeah.
command
Just
would
depends on
almost be
where-
like
what-
going to your supervisor and saying, I'm concerned about this, I feel like I need to report it to, maybe there's another party, like the APTA that needs to know,
Yeah.
or,
Yeah.
but I feel like it's always beneficial to go straight to your supervisor, just to kind of follow the.
Yeah.
Right.
At the code of
I'll
ethics.
actually read principle 4. This is the core value of integrity. So 4C reads, physical therapists shall discourage misconduct by healthcare professionals and report illegal or unethical acts to the relevant authority when appropriate. So like we already discussed, we don't know for sure that now it's a legal drug at this point.
But if worst case comes to worst, and it is like
Right,
yeah.
heroin or cocaine, then that,
So it'd be sort of-
yeah.
I do want to cover another one from Principle 5. This covers the core values of professional duty and accountability. Physical therapists shall encourage colleagues with physical, psychological, or substance-related impairments that may adversely impact their professional responsibilities to seek assistance or counsel. And we kind of already said we do that. This is our first option. We encourage him to get help. But then the next one says, physical therapists who have knowledge that a colleague is unable to perform their professional responsibilities with reasonable skill and safety shall report this information to the appropriate authority. So first we try the encouragement like we talked about in our options. If that doesn't do it, then we have to take the option of reporting.
And then I think it's important that if you do report it to whatever authority you feel appropriate, it's all out of your hands and that should feel nice, but I still think it's your duty to kind of follow up. Like, we'd like to assume that they're going to do the right thing, but like, if you know he's using drugs and you've reported it and then they don't do anything about it because they don't think it's true, I still think it's your maybe responsibility to go somewhere even above that to make sure that like,
He's your friend. You want to look out for your friend.
Right.
You know.
Make sure good is done for every person.
yeah. So it's kind of like, yeah, it's like kind of like following up and evaluating everything. So.
Well, I think we've covered everything, and we are past 15, so unless anybody has any thoughts, I think we're good.
Alright. Everyone.
Also, I think my computer froze halfway